morning, everybody. Delighted that you could join us today for February's Health Innovation Community Partnership meeting. Before we get started, I just wanted to ask everyone to please, if you are here under someone else's name, I notice we have several people sharing one name. If you could please rename yourself. We take attendance at these meetings and like to know who's joined us. So like I say, if you are currently here, particularly I think we have several people under the name Blanca right now. If you could rename yourself to share with us your actual name, that would be wonderful. Also, if you are on the phone, if you would be willing to enter your name with your phone number in our, well, I guess you can't do that. I was trying to think of a good, easy way to be able to acknowledge everyone who's joined us today. Of course, to have as many people join us as possible, but we want to be sure that you're included in our announcements that are sent out after the meeting, as well as that your attendance is included in our meeting minutes. With that, we'll go ahead and get started. My name is Heather Hayes, and I am here to facilitate our meeting today. We have a very full meeting as always, and we're very excited to have such a wonderful set of presenters to share with you today. As we get started, the first thing up is tech tips for Zoom meetings. We want to make sure that this is a participatory and interactive session today. So please, first and foremost, pick the language of your choice via the globe at the bottom of your screen on your Zoom meeting controls. That will enable you to participate in the meeting in either English or Spanish, as you will be able to all comments as well as presentations translated into the language of your choice. Dalila, would you care to make the announcement in Spanish for me?
Buenos días, por favor, elijan el glóbulo de interpretación abajo de su pantalla para poder escuchar la junta en el idioma de español.
Perfect, thank you. We also want, for those of you who are interested, you can click on the participant button to show a list of everyone who's joined us for the meeting today. And we want you to be, once again, participating in the meeting freely. So please feel free to enter comments and questions in the chat. That way you can record any thoughts as our presenters are going forward, and we can be sure to have them answered at the end of each presentation. You're also welcome to raise your hand. There'll be moments after each presentation where we invite questions and comments, and we'll be sure to call upon you at that time. Really, our preference is that we will have as much Q&A as possible during the session. Each of our presenters has allocated some time at the end of their presentation, so get those questions ready as we go through the presentation today. Now, looking at our agenda, we're excited once again to have a very full meeting today. We're going to have an update on the Restorative Care Village Permanent Supportive Housing. We're also going to hear a little bit about mental health during COVID. We'll have a great update from our colleagues at the Department of Public Health on the COVID vaccine rollout. We'll also have an update from Orozco of the LAC-USC Medical Center to tell us how the campus is faring under these times, these very incredible times that we're living through. We have a great update from our friends at WEDAX about workforce development opportunities. And we'll be hearing from our friends at the Department of Public Works on the Vinya Street project, as well as the campus projects at the LAC Center. We're going to move forward and invite Lynn Catano, Fernanda Palacios, and Matt from the Los Angeles County Development Authority to present with us or to share some updates on the Restorative Care Village Permanent Supportive Housing.
Good morning, this is Lynn Catano. I'm Director of Housing Investment and Finance at the LA County Development Authority, and I'm glad to be here this morning with you. I'd like to introduce my team that's going to be leading the Permanent Supportive Housing Project at the Restorative Care Village. Matt Lust is the Manager of Finance and Development, and Fernanda Palacios is the Project Manager. They will be doing a short presentation to give you an update on the project today.
Good morning, everyone. I'm Fernanda Palacios. As Lynn mentioned, I'm the project manager with the LA Community Development Authority. So we are working together with the county on a request for proposals for the development of permanent supportive housing on a site that's owned by the county. There's an aerial photograph here of the site. The site is in the city of Los Angeles. is about 2 acres. As you can see, it's triangular shape. It's Avenue, Mission Road, and Griffin Avenue. Currently, the site is occupied by 4 buildings associated with LAC USC Medical Center, including a childcare. Historical uses at the site include manufacturing and industrial. Counties also to report to determine if there's going to be any environmental issues that would need to be addressed before development of the site takes place. Also, the environmental impact report for the LAC USC Medical Campus identifies this site as workforce housing. So the request for proposals, the objectives of the RFP is to solicit proposals from experienced developers that can construct and operate supportive, affordable housing projects that will serve homeless populations that would qualify under the county's No Place Like Home program. The project can also serve homeless veterans, general special needs populations, low-income families and seniors. This RFP would also award funding under our No Place Like Home program, and also Section 8 project-based vouchers for rental assistance. Next slide. So the next steps in this RFP would be to receive the findings from the Phase 2 report. The Department of the Public Works is leading that effort, and they do expect that to be complete by March. We want to see the formation of a group, working group, to be able to review this RFP and provide feedback on options for development of the site. We do want to incorporate those comments as part of the RFP before we release it. Next slide. And here we would see an estimated timeline for the RFP. We do expect to be able to get the results from the Phase 2, and then at the same time receive feedback from the working group to incorporate on the RFP by April. And then we anticipate if we will be able to issue the request for to release the RFP by May. As part of the process, we also hold a mandatory pre-proposal conference, and we also issue Q&A, questions and answers, and we expect that to happen in June with the proposal due date in June. We do expect to select a proposer by September, and after we select a proposer, we expect that we will be able to present to the county board for approval at their meeting in November. This concludes our presentation. If any questions, we're here to answer any questions from the group.
Thank you, Fernanda and Lynn. And I know Matt is joined from your team as well. I understand that there's an opportunity for HICP members to perhaps join a group that might provide some inform the RFP process at all, at least around the community engagement effort. Is there something you'd like to add around that? Lynn, Fernanda?
I'm sorry. Good morning. This is Matt. I was on mute. Sorry about that. Again, I'm Matt Lust with the LACDA, and we will be asking for participation from the HICP group to review the RFP, provide any comments, and then as the project progresses further, we will have we'll ask for participation from the group as well once we start getting proposals and start to review those. So yes, there will be ample opportunity for the group to participate.
Thank you, Matt. We also have a question in the chat from Pamela asking how many units of permanent supportive housing are being for inclusion?
So at this time, we don't know how many units there would be. We are waiting for the proposals to come in, and then we'll be able to select the best proposal that that is provided. So right now we don't have much information on what the project would look like until we get the RFP out and responses back.
Is there a range that's being considered?
The site does have the capability to house a large number of units. The upper limit is probably over 300, which is quite a large project. But it just depends on the desired lot coverage and the density of the housing that's desired as to what the upper limit might be. But there is quite a lot of space to develop housing there.
Wonderful. Thank you. So I'll reiterate before we move on. Are there any additional questions? Oh, we do have an additional question. Roberto Roque is asking, are you incorporating community members as part of the RFP review process?
So we have not determined the composition of the review process, but we will talk to the first supervisorial district and the HICP and other interested members to solicit input on kind of the selection committee. So we're not at that stage yet, but we will make sure that we reach out to the group and to SD1 to make sure that we have good composition on the panel.
Thank you, Matt. Any final questions for our friends related to the Restorative Care Village Permanent Supportive Housing RFP? All right, Matt, I'll ask if anyone from the Health Innovation Community Partnership is in being part of the review process of the RFP and perhaps serving on a working group committee to provide some feedback to the process. Please go ahead and enter your name and email address in the chat, and we'll be sure to include you in communications. With that, thank you so much for joining us today, Matt, Fernanda, and Lynn. And I think next we have our colleague, Dr. Jorge Partida from the Department of Mental Health. And he's here to share with us some reflections and thoughts on how our community is faring from a mental health perspective under this pandemic. Welcome, Dr. Partida.
Good morning, everybody. Thank you for having me. It's wonderful to be here with you. In these times, you know, it's so easy for us to think about the physical impact of this pandemic, and sometimes we forget that psychologically our communities are being bombarded by concerns and responses that are unprecedented, particularly for the underserved Latino, African American, and other marginalized communities that oftentimes don't have access to some of the basic tools that we need to be able to stay connected. For example, in this case, technology and the internet have become the primary sources of connection to those that are oftentimes marginalized. The other component that often makes it so difficult to connect is that we realize that there are some communities that really rely much more heavily on the familialismo and the close relationships that really give us a sense of identity and assurance and security. And when we tell our communities that, you know, they cannot touch each other, they cannot be around family and loved ones for their own sake and well-being and for their own protection, clearly we send a very confusing but necessary message to stay physically healthy, but psychologically really hunger for that level of connection. We have seen in the Department of Mental Health and significant increase in calls that are coming in due to domestic violence. Self-harm has been something that we've seen an incredible rise in cases. National stories have really focused on the rise of self-harm on youth and marginalization, further isolation. That sometimes really makes it very difficult for young people to stay focused on the aspects of education that are so critical in this time. And speaking of education, the other component that is often very difficult to manage during these times has been the significant weight and responsibility that's added upon parents to help children navigate online learning during this time of being at home and having to be, in essence, homeschooled. with parents that often not only not understand the technology, but really haven't really understood what the individual learning plan is for each child in order to be able to maximize that level of participation and assistance that is so necessary for a child to be able to stay on task and to keep on their learning track. So we are seeing some significant delays, not just in terms of the cognitive and learning styles of children, but also particularly in the social aspects, the socialization and the connection that is so critical to a young person's early development. I'm sorry, somebody say something?
I think there was
So-
just some feedback. Please
Okay. So, so in addition to these challenges, we also all have heard about the long-term neurological impact of COVID during this time, and that's something that we also have yet to fully understand what the long-term impact of that is going to be. UCLA, our partners at UCLA have put together
In any case,
neuropsych sequelae presentation that is offered to our clinicians to just sort of understand some of the neurological long-term impact that might be in impacting particularly young developing brains. So all of these concerns are definitely on our radar and something that we really need to consider. During this time, I think one of the things that has really been very, very helpful has been to use a paraprofessional initiatives such as the Promotoras de Salud Mental that with the Board of Supervisors and Supervisor Solis in particular, her leadership has created the expansion of that model into other underserved cultural communities. Of particular emphasis has been the African American community, the API community, and the Alaska Native American communities that historically have been underserved. We have opened up that expansion program and have created opportunity to hire another 150 individuals to serve population, and have opened up the application process to all underserved cultural communities, which would also include the LGBT community, Access for All, which is the physical disabilities community, and the Eastern European communities. Our hope is that by having individuals in the community that are part of the community, that they're really the subject matter experts when it comes to cultural context and cultural relativity as a means of engagement and connection to those that are underserved, so that we can expand the message and really begin to think about culture-specific approaches that we can utilize to not only engage communities, but to really think about what does mental health mean to each one of our cultures and communities, and to really kind of begin to think outside of the box for culture-specific approaches to healing and wellness. In the example of the Latino community, you know, as we know, we often use herbs and connection and culture as a means of really addressing mental health concerns. And so our hope is that with these initiatives, we'll be able to get greater participation in the community and in the county by those that have been underrepresented. We want to make sure that some of the stigma and fear that inevitably and understandably comes with receiving services from a county government or a large institution such as the Department of Mental Health, that those fears are alleviated by creating healthy spaces where difficult conversations and dialogues can be held. I think now that we're pushing the vaccine, we understand the hesitation and the fear that sometimes is out in the community, and the misinformation that often deters people from being able to receive the vaccine and the mental health support that is needed during these times. So these are some of the challenges that we're focusing on. We do anticipate that the long-term psychological and social impact of this pandemic is going to be seen for the next few years. It certainly has made us all think more clearly about our need for social contact, the things that we take for granted as we go out into the streets and enjoy our favorite restaurants or enjoy a nice walk in the park. I think particularly for children, we've had to, children and elderly, we've had to really kind of rethink about those spaces, where we go to pray, where we go to socialize, and when we go together. Certainly not having access, automatic access to those spaces and those environments has really created a significant increase in our own sense of depression and isolation, which, as you may know, are the primary causes of addiction and mental illness. So certainly much more for us to look at and to analyze and keep alert. But you know, your hard work and dedication is certainly most appreciated during these difficult times. I'll stop there and see if there are any questions or comments on these initiatives.
Anyone have a question for Dr. Partida? A question or a comment? Dr. Partida, I just want to I personally want to comment and say I think we could have an entire conversation, an entire session just dedicated to this conversation. There's so much in what you said. There is so much, I think, in what each of us is experiencing and hearing. I wanted to reflect that at the Wellness Center, you know, we have an open phone line where we receive calls from community members reaching out for help of various kinds. And we've seen a pretty significant increase in the number of people looking for treatment for alcohol and substance use disorder.
Yes.
Not a traditional condition that people reach out to us for, but I feel like there must be quite an increase in the community that we're receiving those calls as well.
Thank you for that. Yeah, that's certainly the co-occurring disorders calls have increased significantly, as has domestic violence and self-harm. And I think it's interesting to see, you know, the ways in which everybody's trying to cope. So it's important that we prepare ourselves also just for the vicarious trauma that so many of our workers are being exposed to during this time, as we just really take on, you know, that level of support that oftentimes just really forces us to deal with issues of loss and grief and so much pain and suffering that's happening right now. So I think it's important for us also to keep in mind that, you know, self-care, the importance of being able to stay strong and healthy for ourselves is going to be one of the best ways to really continue to provide the service to our community.
Absolutely. Oh,
Heather?
yes, please. Go for it, Alex.
I just wanted to say thank you so much, Doctor. This is really great work and looking forward to a deeper dive into the report. I think being conscious of this information and where mental health comes in and substance abuse, what have you. I still remember at the beginning of the pandemic, the lines at BevMo were long.
Yeah.
And I think it's really interesting how so many people were thinking of these. I'm speaking colloquially, of course, the idea that we had so many coping mechanisms that were trying to get us through the monotony or the anxiety or any other more serious pressing concerns on us emotionally and mentally, and that now that those have wrought problems that could be with us even beyond after everyone receiving the vaccinations and what have you. So what is is there a way that we could more I'm at a loss for words, but how do we get this information to people on the day-to-day as opposed to in a more professional forums like we have here now? Like how do we bring this to our neighbors and colleagues and friends and family?
You know, that's an excellent question, and you know, you may remember that, you know, at some point the number of bottles of alcohol that one could buy or could have delivered were really being limited because of the huge demand. The same thing has happened in the dispensaries with this, you know, very strong line. So I think that you're absolutely right that at the very beginning of this, it just sort of became a way to try to distract from the pain and suffering, and then at some point it just sort of becomes the medicine to try to deal with the pain and hurt. and the confusion and the just disorganization of our entire systems. One of the things that we've done is that we've created materials in the 13 anchor languages, and we've engaged our senior clinicians within the department. It was during the beginning of this whole pandemic, and then just the significant shift that we had to do in the department to just really think about outside of the box how to deliver services in non-traditional ways. We did find that there were over 300 clinicians in the department that had expertise in our 13 cultural 13 anchor languages and various cultures. And so we began to engage them in a training that has now become known as the Speakers Bureau, where these clinicians from 13 anchor languages and our diverse cultures are available to do presentations with the town halls that the supervisors put on with various events. And the reason for the seniority of clinical staff, we are looking at the most qualified staff that we have as clinicians. The reason for that is that we want to make sure that when there is a town hall or there is a community gathering, virtually or otherwise, that we do have clinicians that are able to not just provide a 1-800 number for people to call, but that can really help provide the skill set that's necessary if an intervention is needed right then and there, or if there's some need to navigate and to link, in addition to our promoters and promotores de salud mental, that these clinicians can be of further support in that process. I think the other thing that this has allowed us to do is to really begin to create content in the 13 anchor languages that we didn't have before. And a significant subject matter has been grief and loss. So we've and also just sort of understanding the psychological impact of COVID, not only on social interactions, but on the brain. So we've created flyers, we've created original information in the 13 anchor languages that's available for distribution. And we've also added some specific COVID content for during the CARES Act funding that really provided content for teachers, for parents, and for others just around how to navigate this. So that information is available. We can certainly make some of that available to you if you'd like. We created a Speakers Bureau resource library and some PSAs in the 13 anchor languages to help us really get the message out into the community.
Thank you, Dr. Partida. I think we see in the chat as well a lot of interest in getting a copy of the UCLA report, as well as these infographics and materials. So maybe you could have those sent to me after the meeting, and I'll go ahead and forward them around to everyone. I know
Absolutely.
that would be wonderful. I know we have a comment from Diego.
Good morning, Dr. Partida, and thank you once again for lifting such a timely issue, and we hope to be able to provide a more comprehensive presentation. But I just want to lift our Innovation 2 project. We're very blessed, really, to partner with the Department of Mental Health and have one of the innovation projects as a partnership project with the Wellness Center, with Maternal and Child Health Access, with Jovenes Inc., Neighborhood Legal Services, and the East LA Women's Center. And the Innovation 2 project is a trauma-informed community capacity building effort that, besides information and empowerment, also provides concrete resources to the community at the Wellness Center, at Alma's Youth and Family Services Center, and just in the Boyle Heights community at large. We have a number of groups: grief and loss, parenting support, peer-led groups, storytelling, and we'll gladly share that information. One of the questions earlier was, how can we direct people? Well, there are a number of groups happening weekly that folks can connect to. And once a month, we have a large community meeting via Zoom, where we hear from the community about their needs and pressing issues on the ground. So once again, just want to thank you, Dr. Partida, and the department really for sponsoring such projects and funding these opportunities And we hope to be able to further connect with this group and lead a higher number of community members to the services that are being provided at this time. Thank you.
Thank you so much for that. You know, that really does sort of remind me of the Innovations 2 projects that have been supported and our need to really support the communities in coming up with their own culture-based and community-based solutions to some very challenging problems. So I really commend you for the work that you're doing, and want to hear more myself as a form of my own sort of self education around what you've done with that Innovations 2, because I really do think that this really creates a pathway for community ownership and participation in funding sources that are oftentimes, you know, systematized in ways that really unintentionally disengage communities instead of engaging. So I'd really want to hear more about how you implemented that Innovations 2, and see if we could use that as a case sample for other communities to begin to partake in that opportunity. So thank you for that.
Thank you, Dr. Partida. Thank you, Diego. We have several comments, most of which are really just echoing the need for more information on these kinds of services, more connection for our community members, just the sense of grief and loss that is being experienced by so many people at so many levels. And I think the lingering impacts will be felt for a long time to come. I know that is, some people are having a very challenging time scheduling funerals, and you know, even that kind of grief, like how do we celebrate the passing of someone when our rituals are so disrupted? So there's so much to unpack here. I think Diego, Dr. Partida, Leticia, there might be an opportunity for us to really dig in a little more fully at a future meeting. And I know we would all welcome that, because this is a conversation that is not going to end anytime soon, and the need will continue to increase. So thank you so much for your time today.
Thank you so much for the space to be able to talk about these important issues. I appreciate the invitation. Thank you.
You're so welcome. All right, with that, I will, I just, in the interest of time and everything else, we're going to move along. There are questions, like I say, perhaps we can get back to Martha and to Priscilla with some of the questions you've asked. We'll try to get that information and send it out after the meeting. With that, we'll move on. Our next presentation is really a really timely one as well. We have our colleague from the Department of Public Health, Tiffany Romo, who is rejoining us, who's taking a minute of breath from her CARES and COVID work to join us today and give us a quick update. Welcome, Tiffany.
Thank you so much, and so happy to see your guys' faces, be in this group again. I truly miss you, and you know, look forward to it happening and returning again. Love that presentation from DMH. I think it's so critical and so important, and we're just definitely hearing so much from folks out in the community. And so I think with that, I think, you know, talking about the vaccine gives us a little bit of a glimmer of hope of kind of what is coming. Granted, it's going to take a while. And so I really want to level set expectations on what the vaccine is going to do and how that's going to impact kind of our normal, getting back to normal. It's going to definitely take a long time, you know, to get us into a space where everybody's really safe out in the community. But it is a ray of hope, and we are so excited about it. Next slide, Heather. So just a quick disclaimer, as you guys know, COVID information is rapidly changing, rapidly evolving, as well as any kind of information around vaccine or how it's going to be administered, or you know, the distribution plan for the community. So this information that I'm going to provide today is really only as good as, you know, today. It can change. So I just want to put that out there, and any new information that does come up around vaccine distribution, you could find on our website at vaccinatelacounty.com. So, you know, so a lot of people are interested in the vaccine, which is exciting. You know, there's definitely still a lot of vaccine hesitancy, but there is definitely a lot of interest. People are tired, you know, they're ready to get back to life. And so they're, you know, people are eager, and everybody feels like they should, you know, get the vaccine right away, and it should be kind of open to everyone. But, you know, as we know, there is a limited supply right now of vaccine. And so right now, public health is administering vaccine into the community based on the CDC priority groups that have been identified and the state work group and how the guidance that they're providing. So again, the vaccine is going to be distributed in phases across LA County. And this is kind of gives you a sense of the distribution plan. So, and I'll talk about kind of where we are, but there is a big plan in place. But again, like I mentioned before, these plans change, and we already know that there is going to be some changes, based on some new information that's coming from the state. And I will talk about that in a minute. Just keep in mind that, with the vaccine, even though we're starting to roll it out now, there's not enough vaccine for everyone. And, quite frankly, it's not going to be available for the whole general population until spring or summer of this year. The vaccine itself will be free to everyone. There may be a small kind of administrative fee, especially in certain cases, like pharmacies and things that are giving out the vaccine. But that fee should be covered by insurance. And for individuals that do not have insurance, including our undocumented population, there are programs in place. So there should be no charge whatsoever when people go and get vaccinated. So we're currently and actively vaccinating people in phase 1A, and this includes healthcare workers, staff and residents of skilled nursing facilities and long-term care facilities. And then currently right now, phase 1B, which includes LA County residents 65 years and older. So some upcoming phases, and like I mentioned before, some changes is that, in February, so what they've announced that probably mid-February, LA County is going to start administering vaccine to individuals in the education and child sector, emergency services, food and agriculture, as well as a number of other sectors, including transportation, critical manufacturing, homeless settings, settings. But then the state has announced that they're going to be moving to this kind of age-based eligibility system. And so, we're going to get more information on that. But the thought is kind of after this next phase, they're really going to be moving to this age-based system. And I think there's a number of reasons around that. And I mean, I'm sure that you guys know, and as well as you've been supporting your community through just trying to understand this system and kind of what it means and who's eligible. We all understand it's been very confusing, understanding, who's a healthcare worker, who works in this field. And, it's so nuanced and it's been challenging. So I think that is the thought around, moving to this age-based system where it's kind of, clear cut. Of course, there's definitely challenges with that because that may mean that, the people who are most vulnerable are not getting the vaccine as quickly. So it's challenging either way. And I think we're looking forward to getting more guidance from the state and what this means. Additionally, we are going to be moving into a centralized allocation and distribution of vaccines. So this is going to be, ran by the state. Currently, right now, we get vaccine directly from the state, and then public health allocates the vaccine to, pharmacies and clinics and all our kind of provider networks, including ourselves, and we distribute it out. And so we have some say in like who's getting in, kind of where what communities are getting allocated and how much they're getting allocated. And right now this is going to be moving over to a third-party administrator. So it's going to be Blue Shield that is going to be running the allocation across the state of California. And now public health will just become a provider. So we're no longer going to be responsible for the allocation of vaccine to these provider networks. We are, though, going to partner with Blue Shield and provide guidance on what this means to, LA County, particularly about, thinking about vaccine equity and kind of what this means for our communities that are most highly impacted right now. But it's important to know that, as Blue Shield comes in, we are going to be at the table and kind of advocating for our communities, but they ultimately will be making the decision where the allocations go. So currently right now, and this data is as of the 25th. I mean, we should be getting an updated one, I'm sure this week, probably today's Friday, so it should be coming soon. As of the 25th, we had administered up to almost 800,000 vaccines in LA County. You know, this information is up on our website. It's actually really important to look at. And again, going back to the thought of level setting, you know, I think people are very challenged, and we understand it, and you know, we don't back away from it. Is, you know, getting appointments, understanding the, you know, the distribution process is very challenging. It is very hard to message on, you know, and so people are really, you know, having a hard time, you know, getting vaccinated or getting appointments and things like that. But this just kind of shows you, like, we have, you know, administered 800,000 vaccines as of this date. But as you can see at the bottom, we in LA County, as of the 25th, granted this is, you know, it's been a week, we have only received less than 1 million vaccines. And so to put it in perspective, for all the people who are currently eligible to receive vaccines, there's currently, we estimate, about 800,000 healthcare workers, about 1.4 million individuals who are 65 plus. Additionally, you know, 50, 60,000 in long-term care skilled nursing facilities. So, you know, that puts us around, you know, a little over 2 million people who are eligible for vaccine. Currently, we have less than 1 million vaccines that have been received into LA County. And then you have to cut that in half because people are getting second doses. So really what we're able to do right now is, you know, vaccinate fully approximately 500,000 people based on our supply. But we currently have, you know, over 2 million people who are eligible. So again, this is not, you know, the issues that we're having with people getting appointments and stuff like that. It's not an issue of capacity and our ability to vaccinate, because I'll talk a little bit more about kind of, you know, the systems we have in place to do mass vaccination, but it is an issue of supply. And so that is really the challenging, you know, part. We're very, very hopeful that our supply is going to change. You know, there's a lot of talk, there's a lot of movement in the new administration. We are very hopeful that this is going to change and we're going to ramp up very quickly. But it is an issue of supply. And so I just want to communicate that, you know, and have people get a better understanding of what this means, these numbers mean. So this is actually the state's dashboard. So this is a new image that they just started sharing this week. And it kind of shows you kind of where we fall in relations to other county and our administration, how we've been administering vaccine compared to other counties. So you could see that is even as challenged as we are, you know, LA County is actually doing a good job of getting, you know, vaccine into people's arms. Go ahead. So for vaccine administration, so we're doing this in multiple ways. We have point of distribution sites that are run. We have some that are run by the LA City Fire Department. We have several run by public health. We're also partnering, we have a provider network that I mentioned before with community clinics, hospitals, and pharmacies as well. So these are the multiple ways that people, you know, can get vaccinated. So for LA City, you know, LA City has these 5 sites. Dodger Stadium is a drive-through site only. Lincoln Park, Crenshaw Christian Center, San Fernando Park, and Hanson Dam Rec Center are kind of drive up and walk in sites. So there is accessibility at those sites. LA City has their own registration system. Again, that adds to the confusion of getting appointments, and definitely acknowledge that. LA City has their own kind of centralized system in order to get their appointments. And then they also notify their people, any individual that is vaccinated at LA City sites will be notified by LA City about their second doses. Go ahead. So for LA County, we have several sites. So we have 5 what we're calling megapods that are at the Forum, Cal State University Northridge, Laco, and Downey. Pomona Fairplex, and then at Magic Mountain. So these are large scale vaccination sites. They're all drive-through. And then we have two smaller, we call them mini pods. And mini by night, they still have a pretty good throughput of about 1,500 people that could get vaccinated. But this is at Balboa Sports Complex in El Sereno. We had additional two, but we had to kind of close them down in order to kind of redistribute our people and redeploy them into our megapods. And so these are smaller sites and they are walk up. So Balboa Sports and El Sereno are walk up. You could, drive and get in line there. So again, trying to be accessible to people who may not have cars to be able to drive through these large sites. Go ahead. So for the megapods, we're currently vaccinating, currently vaccinating about 24 people a day per site. So at each of these 5 sites, it's 2,400 people. Okay, am I muted, Heather?
Sorry, that was my mistake. I was trying to mute someone else and then the queue changed, so I ended up muting.
I just wanted to make sure, okay. So the megapods, again, we're vaccinating about 2,400 people a day. This does change based on our allocations that we receive week to week from the state. But on average, it's about 2,400 people a day per site. Our capacity, and like what I said, it's not a matter of capacity. We are ready and we're ready to go. Our capacity at each of these sites is 4,000 people per day. Some of the barriers, like I mentioned before, is the supply, right? We have very limited supply. So the more supply we get, the more capacity and more we can push out at these sites. And then also too, there is tons of people working. All public health staff have been deployed and are working, these sites. We've received, help from nurses, like traveling nurses that have come and to support administration at these sites. I mean, I'm out there working, I've worked the sites too. So, if you ever get a chance to go through, if you're eligible or you're bringing, your parent or something, come by, maybe you'll see me. But, there's a lot of effort being made to get people vaccinated, and our staff are out there every day in all of the different weather, rains, cold, sunshine, we're out there and we're eager to vaccinate folks. So like I said, there's also the community clinics and hospitals, so they have their own registration system. Again, we know it's challenging because of this, but so we have, they're eligible, and there's more sites on our website, but we definitely do have community clinics and hospitals that are doing vaccinations as well and are receiving allocations of vaccine. Sorry, next slide. And then additionally, pharmacy. So we've partnered with, large pharmacy chains, Albertsons, Pavilions, Ralph's, Rite Aid, and Vons to do administer vaccine as well. And at these sites, at the pharmacy sites, when you go and you get your vaccination, they will actually schedule you for your second dose right then and there. So you'll get that information right when you get there. So making appointments. So this has been the challenge. We acknowledge it. We are, we are thinking through, we are trying to be innovative, what we can do, what we have capacity to do. The challenge is that we have a lot of different provider networks that are providing vaccines. Several of them have their own kind of registration system. I mean, LA City has their own, LA County is working through the states, their CalVac system. And this is new too, because when we initially started, we were using the state's PrEP mod, and then that got changed. So, it has been challenging, and it's just one of these kind of administrative hurdles and challenges that come with such a huge effort that's going on countywide, and trying to bring all these providers online and get vaccination, vaccine out as quick as possible. It, doesn't really lend itself to centralize very quickly, but is something we're working on in the back end. So when you go on to Vaccinate LA County, you could book an appointment, and we do highly recommend that you kind of go through our system, because you'll have access to all the sites. So LA City's there, we're there obviously, and then there's all the pharmacies and clinics and FQHCs and all that stuff that are there. It's just kind of like a centralized hub for all these different registration systems that are there. And then additionally, we know that access and using the internet is definitely a barrier for a lot of our communities. especially our elderly community, which is being vaccinated right now, as well as our limited English proficient folks. So we definitely see this. People are able to call and try to schedule an appointment through our call center. We definitely hear you that the call lines are, you know, very long. And then by the time people get on the appointments are all gone. Again, is an issue of supply, which is really challenging. And we're definitely working on ways to, you know, we're working on ways to get to folks without them having to go through this process, because it is challenging. We're starting to think through a pilot to go out to kind of senior centers and places where, you know, seniors live, to just give them the vaccine versus having them come in or try to go through the system. I mean, there's a lot of definitely talks going on about how we approve it. So we recognize it, we see it, and we are working to approve it. So new opportunities. This is something we're actually really excited about. So this week, the federal government announced several new opportunities that are going to be coming into LA County to increase vaccinations here. One is that, you know, the FEMA is going to be partnering with the state of California to do these community vaccinations pilot sites. They're going to be doing several throughout the state of California, but currently they're going to be focusing on Oakland and LA County. So here in LA, they're going to be setting up a vaccination site at Cal State LA. This is also going to include 2 mobile vaccination units, so that we'll be able to kind of go out into the community and do vaccinations as well. They're expected to open February 16th. So they'll probably likely start taking appointments for this site sometime next week. And then registration will be available for these sites on My Turn. So this is basically the county site. So if you go onto our website and you say you want to make an appointment, it basically routes you to My Turn, which is the state's run vaccination site. So it's all available there. And then additionally, there's a federal pharmacy initiative. So we currently have some partnerships with pharmacy, but now the federal government is going to have direct allocation. So it's not essentially coming to us and then we give to the pharmacy. The federal government is going to directly provide allocations to these pharmacies to provide vaccines. And so their partners in our area is going to be CVS and Rite Aid. And so they're going to receive direct allocations. What's great about this is that these are separate allocations coming into LA County than what we've already been kind of promised from the state. So this is additional vaccine that's coming in. So we open it, we welcome it with open arms. Like the more vaccine that comes into LA County, the better. And then taken away from our kind of our allocation, you know, it's just more for more people to get vaccinated. Definitely please sign up for the vaccine newsletter. There's so much information there. People have tons of questions, and I promise you most of your questions are probably going to be answered in this newsletter. So if you get a chance, you go on our website, you could sign up for it, as well as our social media. You know, we provide, you know, briefings all the time. We try to communicate as much as we can. We know it's not perfect, but we definitely make the attempt to make sure that people have as much information, probably more information than they need. Next slide. Again, there's a lot of great information on our website, especially around myths and facts. And so we have updated FAQs that are happening all the time. A lot of myth bustings when we hear like certain scams or things that are going on, we share that information. So there's really good information on our website and kind of these FAQs. So please, you know, share. It's available in multiple languages. Download, share, get it out into the community, because we definitely want people to have access. Next slide. So when can I get vaccine? So this is the question that everybody wants to know. You know, again, the plan is changing always, and I think we should have more information for the state pretty soon, probably within the next week or so, about kind of what their age-based system is going to look like. If you go on to myturn.ca.gov, you could actually register there to get notified. You put in your information, like I'm in this, you know, category, I'm this age, you know, I'm not a healthcare worker, I'm, you know, whatever. You put in all your kind of information and how it relates to you, and then you will actually get a notification when you're eligible. for vaccine. Or if you're somebody who kind of does, fall into an eligible group who's able to get vaccinated now, but has been unsuccessful getting an appointment, they will push out notifications to you when new appointments become available. And so the thing is, it's really important to kind of check the website frequently, because if there's cancellations, or if now, we get some additional vaccine that has kind of been reallocated to some of our pods, we push out new appointments during the day as well. But just note of caution, that is only for my turn. So that means it's only for the sites that are use this as the registration process. So that's the LA County sites, the new FEMA sites, any of the pharmacies or LA City, they have their own registration process. So that you're not going to be notified through this. So I just want to be clear about that. And then just, finally, and I'm going to wrap up quickly, is that, there is definitely a lot of efforts around community engagement. We have our community health worker outreach initiative is really pushing, we're ramping up again, and we're going to be pushing out a lot of information around vaccine, particularly in our hardest hit communities, in really to address kind of any myths that are going around, as well as, making sure people kind of, addressing any kind of vaccine hesitancy. Additionally, we have this LA County COVID vaccine work group committee there's 3 subcommittees. One is around ensuring equity, the other is around effective communication, and then aligning resources. So there's a lot of work with very key stakeholders around assuring a real equitable distribution of vaccine into the community. And then, there has been a ton of vaccine listening sessions that have been taking place. We did several with our community health workers, the end of last year, and we did in English and Spanish. There's listening sessions for, healthcare workers and essential workers and people living with disabilities and seniors. There's a lot of effort being made to get people to the table and hear what's going on for them, and trying to figure out how to take that information and really kind of integrate it into our plans as we think about our vaccine distribution. And then finally, it's just a reminder that, we're getting vaccinated and we're excited about that. And it is a light at the end of the tunnel, but it's a long tunnel. We're going to be in this tunnel for a minute. And so you could see that, cases are still high, deaths are, unimaginable. And then, we still have really high, hospitalization rates. And so our system is strained. And so even though, vaccine is coming and it's, we're excited about it, we still have to stay vigilant. We still have to be precautious. And, people, just need to take it serious. Like, vaccine is not like, the golden, it's not going to change everything. It's going to take a long time to get everyone, vaccinated. And then we're still learning more about the vaccine. And, the thought is that there's potentially, we're maybe it's still, people are still infectious, even if they get vaccinated. So they could potentially, infect people who, are not vaccinated. So there's still a lot of unknown. It's exciting. It's, it's promising, especially for me. We're tired. We're so tired. But we just want to kind of keep it real and make sure that people understand that it's a long road still ahead of us. And then, yes, and this is just kind of what I'm saying, is that, we have to continue to take steps to stop the spread. So even after people are vaccinated, again, it's going to take a long time. So we'll continue to wear face coverings, social distance, and do all the things we have been doing, and it's going to be a while. For more information, again, check out our website. There's tons of information. I know it's, there's a lot there, but definitely please sign up for the vaccine newsletter. It's really great, succinct information about what's going on. And I think that's it. Thank you. I'm sure you guys have a ton of questions, so put them on me.
I was going to say thank you. Yes, we do have a ton of questions in the chat. So Tiffany, if you would be able I'm going to summarize some of the questions right now. But if you would be kind afterwards to kind of go through and kind of type back some answers, that would
definitely.
To let everyone know, if you haven't received a copy of these presentations already, we'll be sending them out to everyone who participated in the call today. So you'll have all of these links links sent directly to you via the presentation. But I think the one comment I hear so much, Tiffany, is from the presentation you just gave, we're prioritizing based upon age for seniors, and we're prioritizing based upon occupation for kind of those essential work categories. But has there been consideration for prioritization based upon like impact of the neighborhood? Because obviously there's certain communities that are much more greatly impacted than others. Is there a geographical or zip code based strategy as well, or has that been considered?
Yeah, no, I appreciate that comment. I think that really, very much aligns with kind of our essential workforce. The folks that in communities that are most highly impacted are usually the ones that are still out there working and have to go to work and, face people every single day. And so that's essentially our next kind of phase, is really that essential workforce. But there has definitely been conversation around that. I think, we try to think through like how to get, vaccine to everyone, but ultimately kind of the prioritization is based on the CDC recommendations as well as the state guidance. And I think they have to try to put it out in kind of a standardized way, just because it does, it is for all of California. But yes, I think we think through about like, once people are eligible, how do we physically get there to make, vaccine accessible for them and eliminate barriers. So there's definitely been a lot of conversations around that.
So it sounds like at this time, the categories are still kind of the age and the occupation. There really isn't like a separate category at like really.
No, not necessarily just for like a zip code or a community. Yeah.
Okay. I think one of the other questions was about your doctor being able to either recommend you for the vaccine or to kind of connect you to the vaccine, particularly for those in Medi-Cal. Is there a consideration to go through your doctor versus through the DPH site?
You mean as far as receiving vaccine once you're eligible?
Yes, for registering and receiving the vaccine. And I would imagine that there might be some, like doctors might be able to prioritize some people with, heightened conditions and heightened needs.
Yeah, with underlying conditions, yeah. So I think, again, it's all based on the prioritization and the phases. So once we do, we get to the space where it's people with underlying health conditions, yes, your doctor could definitely make that recommendation. Hopefully your doctor will have vaccine in hand and will be able to vaccinate you themselves. But if not, yes, there will be a process in which that people that do have underlying health conditions can get vaccinated.
Yes, I think that makes a lot of sense. Thank you so much for those comments. We also have a representative, Elise Weinberg from Supervisor Solis's office, and she has some comments to make, and there's some questions that are specifically, I think, that would include the conversation with Supervisor's office. So Elise, I'm sorry I didn't see your note until now, but if you're ready.
No, it's fine. Sorry, Heather. And sorry that I told everyone I have to leave at 10, unfortunately. I wish I could stay the whole time. But first, just want to thank you, Heather, and to everyone for allowing me the opportunity to speak briefly. And thank you, Tiffany. Always a hard act to follow, but happy to try. As Heather said, my name is Elise, and I'm with Supervisor Solis's office. My colleagues, actually, I just want to take a moment. I know several of you know, of course, Wacos and Guadalupe. I also just want to make a note that that we have a new colleague that joined the office on Monday, whose name is Anthony Cespedes, who has joined the supervisor's office as health deputy. So we look forward to having all of you work with him and vice versa, as well as our colleague Alexis Gordon, who is a health equity fellow with Supervisor Solis. I'm not sure, some of you may know her as she works at LACUSC. She's also a doctor at St. John's Well Child. So many hats, but just wanted to make a note that they're on this call as well. So yes, again, thank you for the opportunity. Obviously the vaccine is just top of mind for Supervisor Solis. She actually is leaving the opening of a new vaccine site in Pomona as we speak. Kaiser, along with a consortium of other health providers, is opening a large-scale site in Pomona that'll eventually be able to vaccinate 10,000 people a day. So we're talking massive numbers in the coming weeks, assuming the doses follow. And really the reason for why these pause that Tiffany mentioned and why Kaiser moved forward with having this vaccine site in Pomona, for example, is because these are, as many of you know, the hardest hit communities, and we need to have the sites in the community so they're accessible. Having said that, I've been following the chat and recognize that a lot of people are still not able to access the vaccine, particularly those who are essential workers. Some of those, as others mentioned, are living in public housing developments like Ramona Gardens, which is why Supervisor Solis recognizes that just having these sites in communities that have been most impacted by COVID is not enough. We all have a real responsibility to make sure that the vaccine is getting to the right people, especially when we have such limited doses. And frankly, we need everyone's help with that. As Tiffany mentioned, there are issues with hesitancy. Many in the community still don't want to get the vaccine, but I think that more so the issues are around making sure people have the information. You know, great organizations like Inner City Struggle, for example, have been registering their residents, their members, you know, helping them with that process, because some among the supervisors district in particular just are not able to navigate the very long process. I know Ruby mentioned the wait, like on the call line, we're trying to address that as well. So I just want to commend groups like Inner City Struggle doing that work. Supervisor Solis recognizes that partnership. Additionally, I know someone is saying the Fairplex is not accessible. You know, for some in the community, it certainly is, but we recognize that Supervisor recognizes that we have to bring the vaccine to people, which I know Tiffany mentioned that in the coming weeks, the county will be rolling out mobile vaccine options. Just to back up a little bit, Supervisor Solis sent a letter to President Biden a few weeks ago asking for one of these federal vaccine sites coupled with mobile vaccine sites to be deployed to LA County. In response to that letter, the White House asked for a meeting with the supervisor and ultimately resulted in the announcement of Cal State LA being one of the first federal vaccine sites, which will also have mobile vaccine sites along with that. We're putting together a list right now. We want to make sure those mobile vaccine sites are going to the right places. That means our senior living housing units. It means public housing like Ramona Gardens, which is close to Cal State LA, but may not be close enough for some community members to go there, which is why the supervisor, as part of this, has a board motion on Tuesday. I'm not remembering which item it is, but it would look at other transportation opportunities to make sure community has rides to these megapods like the Fairplex, like Cal State LA, but also that these mobile options are deployed as quickly as possible so people don't have to, you know, carve out a whole day to get there. So I just wanted to mention some of those efforts. I think in the next couple of weeks, we're going to see a lot of movement on this. And so, you know, if you all have ideas, please let me know. I'd see Laura Santos just quickly is asking about schools. Thank you. That is a significant issue for Supervisor Solis. She has been working very closely with the LAUSD Superintendent Austin Butner to deploy the vaccine to school sites. Have had several conversations with them. I think today maybe there's going to be some announcements where vaccine sites are going to be rolled out at school sites, and we're hoping to stand up additional sites in East LA. But again, like I said, it's one thing to have the sites in the community. It's another thing to make sure the community where the sites are near are accessing it. And so I think that, you know, any ideas, we're going to be working really closely with the Department of Public Social Services, making sure that they're reaching out to their clients that are enrolled in public benefits as just one example to make sure that they're getting the vaccine and the information around the vaccine as well. Last but not least, you know, as many of you know, Supervisor Solis issued an executive order to open up the vaccine eligibility to those 65 and older. That's a large group, as Tiffany said, but we're really hopeful with these mobile vaccine units being rolled out that we're going to start to make a lot of progress in the first district, given that the number of cases, hospitalizations, and deaths in the first district is just so devastating. So again, just want to make myself available as well as the rest of the team. You know, we really want to work with community on this to make sure the vaccine is getting, and the information, of course, is getting to the right people. So thank you, Heather.
Heather, this is Yolanda. One more thing on Lisa's topic the partnership with Kaiser, you don't have to be a member to make your appointment, and that's an important thing. So they're doing it at a lot of the Kaiser sites, so Walden Park and closer to us even, and they have an actual COVID line. I was able to get 2 appointments, one for a 99-year-old aunt and one for a 90-year-old aunt. And they were very accommodating. It was really surprising. So just so you know.
Thank you, Yolanda. That's a really excellent point. Thank you for raising that. This Kaiser site, as Yolanda said, is not just for members. It's also, I should mention, not just for LA County residents.
Right.
They're also going to be serving, I believe, San Bernardino County and Orange County residents. But again, 10,000 doses each day eventually. That's very significant, which I think is going to be a really good resource for community. Thank you.
Elise, before you leave us, I have 2 quick questions, hopefully one quick and one maybe a little longer. The first is with the mobile clinics, is there an ETA as to when those might be online?
Sure, I think soon. So my understanding and details are still forthcoming. So there's sort of a couple mobile vaccine efforts underway. The first is as part of this federal partnership. The Cal State LA site is going live. I think Tiffany said February 16th. So I think we expect the mobile units to be deployed on that same day, if not soon after. My understanding is Cal State LA is actually going to be like the launch ground for those mobile units. So I think that it's tied to that. Separately, I know DPH is working to roll out our county mobile units as well. Currently, we're focused on vaccinating residents and staff in our skilled nursing facilities. We're almost done with, we're almost there. And in the next couple of weeks, I think what's going to happen with those staff is they're going to be redeployed to serve as mobile units. So I think we'll have a few different mobile units rolling out over the next couple of weeks.
Perfect, thank you. The last comment I'd like to make is about the waiting lines on the phone number. As you know, a lot of people with technology challenges are going to default to that 833 number. However, I'll read, reflecting on comments in the chat and the experience of our own navigators at the Wellness Center. It's not perfectly Spanish language fluent right from the outset, number one, and the waiting lines are just too long. It would seem to me like that should be something that could be fixed with just additional staffing to be able to answer the phone and just help connect people more quickly and answer questions and give people confidence and comfort in the solution.
Yes, we couldn't agree more. In fact, the supervisor's office had a conversation with Dr. Ferrer of the department just yesterday about this issue. DPH has tripled the number of staff at the call center. Having said that, I think most people aren't realizing that it's not making a dent. So I think we're going to continue to staff up. And I heard, Dr. Ferrer understands the issues and is going to be working to really enhance the call center over the next couple of weeks. So again, if there are suggestions, Heather, this is the first I'm hearing that, the Spanish proficiency of the call center isn't, up to par. So we'll take that back. And again, I think we really want, like Inner City Struggle, like I mentioned, and others like you, Heather, people registering their community members. Obviously that shouldn't have to happen, but in some instances, it's almost the best, thing, someone who's trusted and knows how to navigate the system. So I think we really are going to hope to create that infrastructure of CBOs to help get people appointments.
Great, that absolutely answered one of the other questions, which is how can community-based organizations become part of this solution in terms of connecting and providing trusted information out to community residents and just helping take the load off, but be good sources of disseminating information.
Yes, and I also just want to close too, like we'll get to a point where we have enough doses, but not enough interest for the doses. And so I just really want to underscore the need for us to do that work now, to get people ready. And I know this is the responsibility of government, but I've seen organizations really take this on as well, like LACUSC, posting pictures of people getting vaccinated, neighbors talking, and letting them know their experience with getting vaccinated. So I just really want to encourage those efforts because they ultimately make the difference. And I think, once we have more doses, we just need to make sure that they're being used. I think we're very aware of the possibility that it will come to a certain point where not enough people will be signing up for the vaccine. So we have a lot of work to do on that with our partnership with community.
Thank you so much, Elise. And thank you and everyone at Supervisor's Office for being such strong advocates for these communities that we all work in and love.
Thank you, Heather. I'll put my contact information in the chat in case anyone wants to get in touch.
Thank you. As mentioned, there were several comments and questions we didn't fully get to explore in today's conversation. We are, of course, running behind schedule, as is not unusual with this particular meeting, because these are incredibly important topics that we want to discuss and share. Next, we had invited Jorge Orozco to come and give his regular update to all of us of how this COVID pandemic is impacting the LACUSC Medical Center. As we are so late in time, Jorge, I don't know if you have time to spend with us today.
Sure.
Oh, you're there. Yay, excellent. Hello.
Yeah. I can be brief. I really am honored to be here. I miss all of you. I miss seeing you all here at the hospital. But this last month has been quite a challenge. And the good news is cases are going down, admissions are going down, and our case count is going down. We're currently at about 150 patients with COVID in our hospital. About 50 of those are in our ICUs. So there's still a significant number of folks coming in. But we peaked about 3 or 4 weeks ago at 280 patients. So it's a significant drop. We are now really focused on all of the care that has been delayed. In order for us to have survived this surge, we moved basically our entire outpatient staff to the inpatient hospital. And so there's a lot of procedures, surgeries, important physician visits that have been delayed. And so we're focused on repatriating folks back to their clinics, and so that hopefully soon we can start getting our outpatients back in for the care that they desperately need. We're also heavily invested in the vaccination efforts. We've vaccinated over 9,000 individuals here at our site. We started vaccinating patients over 65 that are assigned to us a couple weeks ago. And tomorrow will be our very first drive-through vaccination clinic for patients. And we expect about 200 patients to receive a vaccine there. So with that, I'm happy to answer any questions.
I have one question from Vivian. It's about the vaccine, and her question is, we are concerned about the type of vaccines that are currently being given and if a new revised vaccine will be coming after research has been done. When can we learn more about this?
Yeah, great question. There's a lot of media attention on these variants and whether the efficacy of the current vaccines are going to be effective against these variants. The evidence is still not out there. The value of vaccinations is not on the individual vaccination efficacy, whether it's 60%, 70%, 80%, 90%. The value of this is to vaccinate enough people in a community so that the virus doesn't spread anymore. And so I guess I would encourage people to not worry about what vaccine is offered to them and to really take the first vaccine that is available.
We have a question from Juana, which is in Spanish. Unfortunately, I can't read it, or I can try to read it. Quiero agradecerse por todo el esfuerzo de trabajo para la comunidad.
Thank you, Juana. Appreciate that.
Thank you very much. It wasn't a question, it was a comment and a compliment, I should say. Do we have any other questions for Jorge or wrap-up questions kind of related to the vaccine process as it's happening at the LAC-USC Medical Center?
I do think it's important to note that our staff, you know, have been amazing throughout this, and you know, the amount that our staff experience has been really unsurpassed. And so we really are concerned about the health of our staff, the wellness of our staff, and you know, have reinforced the initiatives we have to really help our staff through this. It really, I mean, just the numbers of deaths because of COVID have been outstanding, and really, I think people are suffering without their families because families aren't allowed to be in the hospital, and it's really the staff are the ones that are there, often with iPads trying to connect with family members, etc. So that's been really, really hard for our staff, and just want to recognize that.
Absolutely. Thank you, Jorge. We have some wonderful comments in the chat from our colleagues at Inner City Struggle about the strategies and how the CBOs might be able to help with some of this information campaign. We also have a question from Ozzy. Are there good myth-busting information like a video or something that could be shared out with the community-based organizations so we could help at least promote the idea of vaccine safety and, you know, help answer questions people may have?
Yeah, you know, we have a weekly town hall meeting, and I'm happy to share that link with all of you. And it's where our experts take questions live from our staff mostly, but there's a lot of people externally who listen in, and really tough questions about the vaccine, about COVID, about what's going on. So I'm happy to share that. We also have scheduled a town hall meeting with Bravo High School, and that's I believe that's next week, and we can send out that link for anyone who would want to call in and participate.
That would be great, Jorge. If you share that with me, I'll make sure we get it out to all of our attendees. Final question, as we are behind time, we need to wrap up. How are you doing in terms of vaccinating your own staff population? Where are you at in that?
We're about 55% of our employees vaccinated.
I'm sorry,
65%.
65%. Congratulations. That's great. And then I think one last question from Ari. Are people surviving COVID more now through therapeutics? Is there a greater survival rate because of what we've learned about the disease?
Hard to say. I know our treatment options are more now than when this started, and our knowledge of what it takes is more. But we don't know if the variants or if the current people who are infected, you know, their mortality is higher, irregardless of what our treatments are. So it's a hard thing to sort out, and I think over time we'll get a sense of whether that's true or not.
Great. Well, thank you, Jorge, so much for joining us as always and your patience with our shifting schedule today. We appreciate getting to hear from you as always. With that, we're going to move on. I think this will be another interesting portion of the conversation around the COVID vaccine efforts. I'm going to invite Isidro Villanueva from WEDAX to share with us some workforce development opportunities as it pertains to the to these current times and circumstances. Isidro.
Hi, thank you, Heather. Good morning, everybody, and hopefully I can share my screen here. Let me see if it's, just let me know when it's up. Heather, maybe.
Yep, it looks good. You got it.
Awesome, great. Thank you. So again, good morning, everybody. My name is Isidro Villanueva. I'm the Senior Business Engagement Manager with the Workforce Development Aging and Community Services Department with the county, or as people call it by its acronym, WEDAX. And I'm here to kind of give you, I want to share kind of a couple of things with you this morning. The first being a report that we will be releasing on next week, I believe on Tuesday. I believe Supervisor Solis will be making an announcement. And this is a report that we partner with the Los Angeles Economic Development Corporation to show the impact, the impact of COVID, but then ultimately kind of what do we do to get out and help the economy recover, not only short term but long term. And in addition to that, look at our communities and our individuals that have been impacted severely by COVID-19, and again, how do we address those impacts, and again ensure that there's equity in the recovery. So again, we'll be making an announcement next week with the Supervisor Solis on the release of its report. This report in its entirety is about 300 pages long. We have a condensed version of it, which is about 50 pages, and then an executive summary that's about 17 pages. So there's a lot of information in this report. I just have like 2 slides on it. So like I said, I can spend a whole presentation on the report itself, but I just kind of want to share some quick highlights of the report. And again, we'll make the report public and available, so then everybody can kind of at their leisure go in and read it and kind of have some of the key findings. But here's some of the impact of the economic impact of COVID-19. So initially, when the Safer at Home orders were issued, we know that there was over 700,000 jobs that were lost. Since then, 30% of those jobs have been recovered, but there's still over 500,000 jobs that are unrecovered. So again, there's still a lot of work to be done there to get people back to work. We also know that there was a decline in the number of small businesses in LA County, and they declined by 28%. Through March and August of last year, over 15,000 businesses in LA reported closure. And again, some of these as far as the jobs that were hit hard, we know they were hit hard in hospitality and accommodation, food services, personnel services and laundry, arts and entertainment, motion picture. Again, all of them lost jobs well over 25% in those industries. And so then we know that there's, again, a need to recover these jobs, but particularly there's a need for living wage jobs, okay? We know that over the next couple of years, the county needs to create over 738,000 living wage jobs to get all of our a little over 4.5 million county employees to a living wage standard, okay? So again, there's a lot of information in this report and the executive summary, so I invite everybody to take a look at it. Because again, within the report, we also outline 8 recommendations, again, to kind of help not just the short-term recovery, but also long-term economic growth. But again, we'll be announcing the report next week and making the report available to everybody. Now, within the report, also, we have the projection for the occupations which will be in demand. Like I said, some of these jobs are starting to come back, but long-term, we know that these jobs here, these occupations are going to be in demand over the next couple of years. In particular, the growing industries that we know are construction, healthcare, public administration, personal services, advanced manufacturing, transportation, and logistics. And here you have kind of a short list of the occupations within each of these industries. And again, we go into more detail in the report. But talking about healthcare, which has been the discussion this morning as far as the rollout of the vaccines, in healthcare, again, just because, again, obviously, of what we've seen with the impact of COVID-19, as of November of last year, there was still over 9,000, almost 10,000 jobs that were available for people. But moving forward, again, just based on the discussion that you've heard here, we know that there's going to be a need for patient care, jobs within patient care scheduling. Again, you hear all the logistics around just the different sites that are being brought up for vaccines, and then cardiopulmonary resuscitation, CPR. So these are some of the skills that people who are interested in getting to healthcare, where they might see that they might want to go into and maybe get some and offer some training. And again, you know, our department, we run the Counties America Job Centers of California. So we'll be focusing on making sure that we're training our individuals within these growing industries, focusing on occupations that where we see growth. And then obviously targeting business engagement, bringing employers to the table within those industries, again, so that we're getting people into these living wage jobs. Now to talk a little bit about again, the vaccines and kind of what is needed in the logistics in all of these. You hear all of these sites, you know, what's going to be needed in these large scale drive-in or walk-in sites. You know, obviously the plan for mobile units to roll out the vaccines. So I just want to share a couple of efforts that we currently have going on. And I think I might have shared this with Heather, and hopefully it was shared with the rest of the group. So one such organization is a Community Organized Relief Effort, or CORE. They're kind of the ones that are running or doing a lot of the logistics around like the Dodger Stadium sites. And so not only do they need vaccine techs, but they're also looking at those peripheral positions, you know, program associates, inventory assistants, community mobilizers. Again, these are the individuals that are helping with those additional duties around the, you know, the rollout of the vaccine. So they're not necessarily the ones administering the vaccine, right? The healthcare workers, the pharmacy techs, the vaccine techs, but again, the people that are helping people get organized, making sure that, you know, all of the inventory is there, people going out into the community and informing and marketing the access or the ability of the vaccine. So there's a lot of positions, a lot of logistics that go into these different sites. And so these are just some of the positions that are available with CORE. Some of these positions start off at $20 an hour. And again, it's a huge effort. It's going to be an ongoing recruitment effort with CORE. Kind of what, like you heard Tiffany said, there's two different access points, if you will, or processes, if you will, one with the city and then one on the county side. So with CORE, they're doing the same thing where they're recruiting for the city's specific vaccine rollout sites, and then they will be recruiting for the county vaccine rollout sites. And I can share the link again with Heather, and she can share out with the group, so you can keep looking at the jobs that are available, but they will be needing people moving forward. What we've also done with WEDAX, our department here, is we also partnered with CVS Health. Again, you heard Tiffany talk about, you know, all the different stores and pharmacies that will be rolling out the vaccine. So we've partnered with CVS Health, who is particular in needs to fill pharmacy tech positions at all of their pharmacies within CVS and Target, where you'll find some of these CVS pharmacies. And they need them, again, throughout LA County. So what we've done is we partner with CVS Health to kind of get the word out. And what they're doing is they're holding or hosting CVS Health Pharmacy career virtual orientations. So starting next Wednesday and every Wednesday after that, there'll be a virtual orientation to inform people of, you know, what the job entails, how to apply. And again, just walking them through the application process and explaining, you know, the job opportunities that are available with CVS Health. So again, it'll occur every Wednesday, but again, after the meeting, I'll share all the exact details or the meeting details for these virtual orientations with Heather, so she can get out to the group. Now, this is again more targeted with people who maybe are currently completing a training, have recently completed a training, or looking for an opportunity that where there are already a pharmacy tech. So just keep that in mind. But what I also want to talk about, again, it's now building regional capacity. Again, we're talking about, we've been talking about all morning about all these different sites that are, being rolled out, all the different stores and pharmacies. And so they need, a workforce. There is an ongoing demand for pharmacy techs. And so what we did this past Tuesday, there was a convening of all the community colleges around their LA Health training programs. And this was a result of the conversation that took place last month at this HICP meeting. And really it was spurred by a presentation by Dr. Orozco and then a question that Ozzy asked. And so then, I want to thank Ozzy for helping us convene all the community colleges. And I know Heather and Rosa were also in attendance. So thank you to the HICP and Ozzy. And really the interest here is how do we train and how do we get people into these career pathways within healthcare? One, because we know there's an urgent need right now with all the vaccines that need to be rolled out. And like Tiffany mentioned, we don't even know how long it's going to take or what it means down the line as far as the effectiveness of the vaccines and whether it need to be more at a later point. But the community colleges have training programs. The CVS's, the Walgreens, maybe LA County, I believe Ultimate, they're all ramping up and they're all going to be in need of pharmacy techs. So now this is the opportunity to get new people that are interested, don't have a job, want to change a career, want a living wage job, is getting them into a training program. So we're starting to coordinate with all the community colleges. We just did a recruitment effort for a training that's starting next week at LA Mission College. But really the focus here is to coordinate with all the community colleges, make sure all of their pharmacy tech and all of their other healthcare pathways are full with individuals, because again, we understand that there's an urgent need, but long-term, it's going to present a viable career pathway for our community members here. And again, if you look at the report, we'll see where these individuals who've been severely impacted, and hopefully we can train these individuals into these career pathways. So now there's a better sustainable career or job for them versus, running the risk of getting impacted should there be another recession or God forbid, another healthcare crisis. So that's kind of all I have. I know that, there's a lot of information that I can share, but again, the full report will be live next week. And then just please follow us on social media at LAC BizDev, because that's where we'll have all the up-to-dates on the ongoing recruitment efforts, and business partnerships and training opportunities for our individuals. So thank you.
Thank you, Isidro. We have a lot of interesting chatter in the chat. Thank you, Carolyn, your colleague, for joining in and answering some of those questions. I think one of the first questions was how living wage is defined by the county at this time.
Yeah, I don't know if Carolyn wants to chime in, because I know we have a
I did write that in the chat. We use the MIT living wage calculator. I just want to be clear with everyone that living wage is the absolute baseline minimum. We need to be going much above living wage. We like to say family sustaining wages, but the fact that, we have over 4 million workers and we know we need to create at least 700,000 jobs at living wage so that we can return everyone in the county to living wage employment means that, as everyone knows, we have a huge wage theft issue and underground economy in the county that also needs to be addressed as we work on the economic recovery.
Thank you so much. Yes, I apologize for missing that, but I'm glad to give you the chance to kind of chime in, Carolyn, and emphasize the point. There's also some comment, I'm not sure if you're in a position to answer, about the rent relief for those that are really struggling right now. As we know, the crisis has been ongoing and continues for workers who've been, put out of work and or loss of income during the pandemic.
Yeah, I mean, I'm happy I assume you're talking about residential rent relief, and I know that our colleagues at the Department of Consumer and Business Affairs and the LA County Development Authority would be the best position to answer that. But we know that there was additional funding that came down in the previous stimulus that was just passed. I think the county is working on that, as well as some state funding and how that's going to be allocated. And we just continue to advocate for as many resources as possible to continue providing that relief.
Do you have an estimate of the number of residents who are not qualified for EDD or stimulus checks?
Not off the top of my head, but we will return with that information.
And thank you very much. And following on that, there was a comment from Ari about a debacle related to the state EDD relief payments, and any updates you might have on resolution for that, or maybe some more local control.
Yeah, Ari, thanks for that comment. Assemblymember Chu actually just held a press conference yesterday to introduce a series of bills with his colleagues around reform of EDD. So we will be happy to work with the state and our other local partners around any reforms to EDD. I think it's top of mind for many folks.
Thank you. And then I wanted to make mention of the fact that both, let's see, it is Ozzy Lopez as well as Robert Zardaneta has offered contact information for those that might be interested in training and employment opportunities. So thank you everyone for joining this really important conversation as we work to not only restore the health of the community from a physical well-being standpoint, but from an economic vitality standpoint as well. Thank you so much, WEDAX, for joining us today. With that, I will go back to, we have a couple more really valuable presentations we want to power through, and probably will be running a little past time today, so I hope everyone can continue to join us. But we have a wonderful presentation from Sohelia Kalhor about the Viña Street Housing Project. So Sohelia, welcome, and please take it away.
Good morning. Thank you, Heather. Good morning, everyone. I'm Sohelia Kalhor. I am with LA County Public Works. This is my first presentation at HICP, and I'm very happy and proud to provide an update on the Vignes Housing Project. This amazing project has 232 beds for people experiencing homelessness during the COVID-19 pandemic, as well as on-site wraparound social services. All units are Section 8 compliant, and they can be turned to permanent supportive housing. I heard that WACAS indicated during the last month's meeting, and this must be one of the fastest projects we have had in the county history. We accomplished a lot in a very short period of time, indeed. Modular construction was used to enable the housing units to be fabricated while the site was prepared. So you're on project overview. The Vignes project started in 2018 when the county purchased the property that was adjacent to the men's central jail. At that time, the property was going to be used as a construction staging area when the plan was to develop a new jail. However, Supervisor Hilda Solis lobbied that building a new jail was not the county's priority, but rather it should be to provide care for homeless by providing affordable, I think I lost my screen here. Okay, there we go. Rather, we should be providing, places for homeless by providing affordable supportive housing or interim housing. So on September 29, 2020, just a few months ago, Supervisor Solis's board motion was approved, and the Vignes site was funded to provide housing and support services for the homeless. This project is funded by CARES Act funding, which mandated the facility to be occupied by December 30th, 2020. Very, very aggressive timeline. The deadline has since been extended. We had 20 days to substantially deliver the project. So due to the deadline extension, the project will be substantially completed by the end of this month, end of February. So we have a few weeks left. This property is a county-owned lot. So we were able to take jurisdiction over the plan check and the permitting process. On the on-site, for everything on the on-site work. And the city of LA, they have been very supportive and very cooperative, and they have helped us expedite all the off-site work. They had jurisdiction over the off-site work with all the utility connections and installations. So the city of LA will also be providing all the supportive services as well, and they will be operating this project. Heather, would you go to the next slide? Thank you. So this is a site map. As you can see, if you can see, it's kind of small, but the property is kind of like a triangular shaped lot. It's located to the east of Chinatown and west of Men's Central Jail. To the south is the Union Station, and it is also close to Chinatown Metro Gold Line. There is a bus stop right at Vignes, right in front of the property. So public transportation is no issue or problem. Next slide, please. Yeah, this is an aerial view of the lot when it was vacant. It was just less than 4 months ago. It's a 4.5 acre lot. The site was previously used as an overflow parking lot for staff working at Men's Central Jail. The property served as various metal manufacturing businesses since the 1900s. And the site was left vacant since 1995. And in 2018, LA County purchased the property. Next slide, please. And yeah, this is a really good conceptual site design and layout. You see on the north or top of the map, you see two rectangular, long rectangular buildings, pink and yellow. And then to the side, to the right of it, you see the parking area. And then to the south of the parking area or to the far right, you see the administration building. And then on the south side, you see many kind of white and blue rectangles. So the one on top, we kind of divided this site to two site development. We call it site one is the north and the admin and the parking structure, and site two is those blue buildings. Site one has 132 beds. There are two buildings, and each of them are 3-story residential building made out of shipping containers. They're fully furnished bedrooms with private shower, toilet in each unit. And each unit is about like 160 square foot. They were fabricated locally in Carson by Crate Modular. And then the 6,000 square foot modular administration building to the right, that has administrative offices, dining facilities, commercial kitchen, laundry services, outdoor dining, and restrooms, male, female, and in that building. And that was fabricated in Texas. The on-site parking has 18 stalls. We have 2 EV stalls, electric vehicle stations, and 2 ADA. And on also, in addition to that, We have, if you can see the Alhambra Avenue on the north of the map, we are providing additional 13 parallel parking stalls on Alhambra Avenue, sorry. Just additional parking spaces we're providing there for just staff overflow. And also the entrance is from Alhambra Avenue. It's just one single access for security purposes, and the access to the parking lot is also from Alhambra Road. And then, so this is site 1, we call it site 1. And then site 2, which is on the lower part of the map. And you see those, the blue areas. I know it's kind of hard to see, but those are, thank you. Yeah, those are 1-story modular buildings. Those are wood. And there are 100 beds in site 2, 20 single-story buildings, and each building has 5 units in there. They're, again, fully furnished, bedrooms, a private shower, toilet in each. And those are actually a little bit larger than the ones in the metal shipping containers. They're about 175 square feet each. And they were fabricated in Idaho. And each building, each of those blue buildings is 65 feet by 13.5 feet. The budget for this project is $48 million, with $42 million for CARES Act funding. And the rest, the $6 million, is provided by Supervisor Solis's fund. The County of LA is building and built the project, and the City of LA will be operating it. So it was a very aggressive schedule. As I mentioned, the board received approval by September 29th, and we will have substantial completion by end of this month. So, and then we are also around the property, we're providing fencing for security purposes, of course. And we're providing 8-foot high black vinyl coated chain link fence along Vignes, Alhambra, and part of College. And then the rest of it will be regular chain link fence along the railroad track and part of Alhambra. Next slide, please, Heather. Yeah, this is a good bird eye view of the site. And again, the white buildings, those are the 1-story trailers, temporary trailers. And you see in between, there is like a walkway about 10 foot, kind of with the stairs, they step up. And so all the access to these buildings is from that walkway, the entrance, the entry of the door. I see. And then to the left are the 2 3-story buildings, yellow and orange. Those are the metal shipping containers. And to the far back or north of, with all the colored shade structures in the back, and that's the admin building. Next, please. Yeah, and this one is a view of the courtyard between the 2 3-story metal shipping containers. The width of the balconies and courtyard, the width of the balconies is about 5 feet, the walkways, and the courtyard is 28 feet, and we'll be providing landscape in the middle. Next, please. This one is you're standing on the balcony overlooking the 1-story sleeper units and the admin building. Those the white buildings, those are the trailers, the wood trailers, and in the back is the admin building. And again, that walkway is about 5 feet wide. Next, please. This is a view of, this is the admin building and the outdoor dining area outside of the admin building. And as you can, if you could go back just one comment on the paint on the ground. So those circles are paints. Just wanted to mention that. Okay, next please. So this is an actual photo of a fully furnished bedroom unit at site 1 on in the metal containers. That's ADA bathroom with ADA shower. You see the bars there, and the room has air conditioning, you see, and then we have HD TV, and we have room thermostat, and there is a little kitchenette, the microwave, and a refrigerator you see there. And also the bed linen, bath, and bath towels are all included. Next one, please. Yeah, this is another view, and you see the ADA shower with the grab bars again and the kitchenette. Next, please. So this one is a typical bedroom unit layout of site 1, the metal containers. So this is like one container which has 2 units, and in the containers, all the first floor units are accessible, ADA compliant. The second and the third stories, they are also adaptable, and we're providing elevator to those units, so a disabled person can easily maneuver around the entire building with no limitations. And we also have provided plumbing lines behind the kitchenette areas for future sinks if needed. Of course, there is a lavatory in the bathroom. Next, please, Heather. Yeah, this one is another actual photo of a fully furnished bedroom unit. This is the sleeper units, the 1-story trailers. As you can see, again, you have the bathrooms, the bed, the TV, and also the little kitchenette. These units are about 175 square feet. Next, please. And yes, this is a typical bedroom unit layout. This is for the 1-story trailers. So as you can see, there are 5 bedrooms, or 5 units, I should say, in each trailer. And each trailer is like 65 feet by 13.5. And there are accessible units on some of these. Not all of them are accessible, but the required percentage, we have complied with that. Next, please. Yeah, so this is our project timetable. We are pretty much done with the project, except for we're still working on the kitchen installation and some minor punch list items for the housing and the kitchen, and also the admin building. And so the project is, the work is continuing into March 2021, next month. And what we have left to complete is the hardscape, landscape, and the fencing. So substantial completion is end of this month, and we will have some more off-site work that the City of LA is assisting us with. As I indicated, we are providing parallel parking on the North Alhambra Avenue. So we need to get a permit from City of LA for that work, and we're working on that. Next, please. There are 2 providers. City of LA is providing the providers. It's the People Concern and Weingart Center. And I believe their services will start in 2 months, April 2021. And this project targets people experiencing homelessness, PH, within the city of Los Angeles with priority in CD14, includes PH within 500 feet of freeway, overpass, underpass, ramps for people with age 65 years or older. And then the funding of the operation is by City of LA, and they are providing $55 per bed per night for all the units until 2025, and LA County will cover the cost that exceeds the 55 bed per night. Next, please. So these are some really good construction photos. And you see that this is the trenching for the foundation, for the utility, and underground utilities. Next, please. So this is again when we visited the factory in Carson. This was a local factory. They did the modular buildings, and they're repurposing. That's what they're doing. They're repurposing the containers into residential units. Next, please. Yes, this is, as my manager calls it, flying buildings. This was an amazing day. We were there. So they're using the cranes. To the right picture, that's the foundation. And they are setting the containers on top of the foundation. Next, please. Another flying building. To the picture on the left, as you can see, that area, we call it like an alleyway. This is between the two containers, the 3-story buildings, and they're using this for all the utilities. It's kind of, it's about 5 feet wide. And this way you can hide all the utilities there, and at the same time you have easy access to them for maintenance. These are water for fire sprinklers, electrical, everything is in there. And when you look at the middle picture, when you see the flying building, that middle trench is this alleyway to the left. This is before the buildings were set on the foundation. Okay, and then this one, another very nice picture. I think that's like the second floor being added on the metal container, and you see the train going, yes. And this one, that's more complete. So the 3-story buildings, these are shipping containers. You see the staircase to the left, and that green tower you see, that's the elevator that will be serving the 3 units. And all the first floor is accessible on both buildings. And you see the other building behind the yellow. So, okay, next, please. Yeah, this one again is the courtyard between the 3 stories. We saw a picture of it earlier, a complete picture of it, but this is under construction. It's about 28 feet between those buildings. Next, please. And this one, again, is another view of the sleeper units. We call the the trailers sleeper units. That's the site 2 to the right, and site 1 is the 3-story building. Next, please, Heather. Yeah, and this one again, I don't know if you recall on the one-story trailers, this is the walkway that with the steps up, and those are the entrances to the one-story, 175 square foot units. Next, please, Heather. Yeah, this is a photo of the administration building under construction. And you see the train behind it. Next, please. Yeah, and this one, it's a photo they're working inside the admin building under construction. Yeah, thanks. This one, I like that. Hard work to make Los Angeles a better place. This is all the trenching, and that's the alleyway, the utility alleyway to the left. And those are the two buildings under construction. Next, please. And any questions? Thank you, Heather.
For that very thorough presentation and all those beautiful photos. It really helps so much to see the photography that illustrates what's going on. It's very exciting, like you say, one of the fastest projects we've ever seen. And the wonderful news is your colleagues have been fantastic about answering the questions in the chat. So I think we're kind of all caught up. So
great.
So Helia, thank you, Vince, for answering questions, and Wakas as well for answering questions in the chat. We always appreciate hearing about these amazing projects that have come online so quickly and are going to bring so much benefit to some of our most vulnerable residents.
Thank you so much.
Move along. Well, thank you for your presentation. I'm going to invite Alicia Ramos and Iris Rain to join us and talk a little bit about some of the updates on our campus community projects.
Thank you, Heather. And in the interest of time, I'm going to try and be brief about this. So we're going to highlight two of the projects going on right now. First, Restorative Care Village, which is the project we have right next door to the Women's and Children's Hospital. This is really off zonal, approaching the corner of Mission. So you can see from the photo, we have a lot of steel erection going on right now, a lot of vertical construction. This is a very recent photo, and this is what you would see at the site. Next slide, Heather. There you go. So some more graphs, really just giving a lot of heads up on, you're going to see a lot of the steelwork going on right now. So this is what we would call the superstructure to the project, and then we'd be coming in behind it to start outfitting it with a lot of the building systems, mechanical, electrical, things like that. Okay. All right. So switching to Women's and Children's Hospital demolition. This is what our Women's and Children's Hospital looked like right before December. Next slide, Heather. This is what you are seeing on the campus now. So that demolition effort is very much underway. Demolition is occurring. They started on the north side of the hospital. They're coming around to the west side, and I will highlight a very recent activity that we did on the site, which was to remove the plaque and the time capsule. Next slide, Heather. Some more photos of what you would see off the Mission side of the project. Okay, so this picture, I apologize for it being such low resolution, but what you're seeing here is this gentleman is actually securing the plaque that we have on the south side of Women's and Children's Hospital. So just yesterday, we removed that plaque. The plaque is stationed on a marble base. And when we remove that, next photo, Heather, right behind that copper color rectangle you see there is in fact the time capsule that was right behind the plaque. So we were always hopeful that that time capsule was located behind the plaque, and indeed it was. So it was an exciting day yesterday. We removed both the plaque and the time capsule, and those both reside with the Med Center. There you go. There's a picture of the plaque as it lays on the pallet. And then that's the copper box, which is the time capsule. We did not open it. Both items are with the Med Center, and they will be coordinating some sort of event where we can open that. Good thing is that the time capsule had a very old piece of paper on it that indicated all the contents in the time capsule. So we didn't have to imagine what's in it. We have a good idea what's in it, but there will still be something forthcoming so we can kind of commemorate that historic moment too. Okay, so that's the update on the two projects that we've got, I think, with the most activity right now on the campus. I'm going to turn it over to Iris to catch us up on the civic art effort for both those projects.
Thanks, Alicia. Thank you, everybody, for staying late like this. I just wanted to update everybody on the mural for the LACUSC Child Care Center, which is, just to remember, is on State Street on a curved wall. Next slide, please. The selection committee met in January, and Yolanda, I'm going to call on you in a sec to say a couple of words, and selected a proposal by the artist Andrew Hem. And I left some of this text in the presentation because I know the presentation gets shared afterwards. So he did a bunch of image research on Boyle Heights, and you'll see why he included these two images. So water to him is very meaningful because of its the way he states, the way it can move you in any direction, and the way it holds you, and the way it reflects you. And then, of course, the landmarks in Mariachi Plaza, which are so iconic. Next slide, please. So this is his first mock-up of the mural, the Child Care Center, and he's using very, very succinctly, he's using this idea of the jump rope and of jumping rope together as something sort of joyous and inspiring, and something for the kids to look forward to, but also as a way of communicating how people work together. And the way he phrased it is, in a game of jump rope, no one, there's no hierarchy. Everybody's playing their part, and that's how the game works. Yolanda, do you want to jump in and sort of talk about why the committee felt this was such a strong
I think we were all moved by the diversity of the community that the children represented, that they look like ordinary kids. They look like our kids would look, and their friends. That there was something recognizable in the background was almost an anchor, and that I don't know, their image was mirrored down below, if you can see it. It's just a shadow of them in the water, and that was soothing and comforting, and really struck us all, I thought. We were worried in the beginning about how this would be over time. And we actually thought that these children would look like children 20 years out from now, I think, and so I think he did an excellent job.
And I wanted to add, so his, oops, can you go back? So in the image, he's both representing a Boyle Heights images that are known, and also sort of a little bit of a dreamlike atmosphere.
I forgot that.
Yes. His engagement specifically is in the next month, and I'm going to rope in, Rosa and the Child Care Center on this, is he wants to work off of photographs of actual children in the community, and have them influence the specific children that are there. So he's mapped it out, but the facial traits will shift a little bit based on images of real kids. So I'm seeing some of the comments here. So the way the committee was structured, this time we had two main areas of community representation. So one, of course, district was there, and district arts representative was there. but Yolanda is representing HICP. And then there were two parents who from the child care center who sort of represented the voice of the child care center. And what we tried to do is really foreground their experience and their thoughts. And we had actually paired them together so that they wouldn't feel intimidated by the panel, but I think they blew everybody away. They were so articulate and so clear about what their needs were for this mural and their vision, and hands down, this is the mural that the child care center really felt invested in. So this will be a permanent mural made of glass mosaic. And the artist also talked about how from afar, this mural will look sort of like this. Of course, shifted a little bit the way we discussed. And then up close, there will be the individual sort of little mural tiles, which the children can then touch and write and see in a different way. So there'll be two images of sort of the pixelated images. That's just sort of the colors that can be touched by the very little kids. And then from afar, this image that comes together. So he's thinking of tiles that are about 1 inch by 1 inch.
We have one question in the chat for you, Iris. It's really representing the physically disabled.
That's interesting. We can talk to him about that. He's very interested in actually having the community represented. So that is something, he's very open to that sort of thing. It's open to all comments. In this sort of preliminary, sort of final organization of an image, but still preliminary facial traits and all this, he was really showing sort of how it's all going to work together. So that's a great point, Ari. We'll definitely talk to him about that.
There was a question about what is the meaning of the jump rope?
Oh, so here actually, if you could go to the next page, please. These are, I don't know if everybody can see this, but this is his words. He started, I would say maybe even more than any other of the artists, he started with the community words before image, before anything. And he was thinking of trust and welcome. And then he was thinking, how do you capture that very simply so that these are complicated notions, but so that a child would have that feeling also. That's how he came up about jump rope, right? So he's saying when you jump with multiple people, it's playful, it's filled with energy, it's non-hierarchical, there's no rivalry, right? It's something that people need to do together. Like that's how it works. And when he was talking about it, I think everyone could just see that, and you could see from it's something that's it's a very great, or it's a very simple visual metaphor. The child care center. So this is how it looks on site. So you'll see, and this is so on approach. This is what people will see, and then when kids are in that little area, that's where they can do the touching. Somebody asked about whether the child care center will be a 24-hour facility. I don't actually have the answer for that. Maybe somebody else could jump in and answer that.
And ask Alicia, do you know, number one, when the child care center is expected to open, and number two, number of slots and hours of operation?
Yeah, so let me comment on first the construction completion. So we've had some delay on this project. We don't anticipate that this is going to be done until November of this year. As far as slots available, the child care center was designed for 72 children. And operation is going to be handled by an outside vendor. So I can't speak specifically as to whether or not it would be a 24-hour operation. I've not heard that. My guess would be at this point is that it would operate similar to the one that's already in operation. So if that one is open 24 hours, I would think they would continue that, but unfortunately, I can't confirm that. But I will certainly ask the question to see if we can get some sort of confirmation on it.
And also, Alicia, if there's a sense of those 72 slots, is there a certain number that would be for staff versus for community? Is there some sense of that?
So my understanding is that the intent is that the child care center would serve both the med center and the surrounding community. I don't know that it's been confirmed that the med center staff would have priority or not. I think that's also an operational question we'd have to dig into, but the general intent is that it should be available to both staff and community. I think the balance between how that's spread is the question. And then Heather, I did want to acknowledge there was one question that came in on the Women's and Children's Hospital time capsule. There was a question about when it was first sealed. It was first sealed with the building when it was constructed in 1956.
Thank you.
So then I just wanted to give a super short update because I'm very excited about it, about the fabrication right now of the LACUSC murals. So right now, 3 of the artists are in fabrication, meaning that their artworks have all been digitized and they've finalized color samples and all of that, and so tiles are being made. So if you recall, this is Jamie Skolnick's final design. Next slide, please. And we just did a tile check. It's what we call a 20% check, and you can see how the painting that you saw is now translated into tiles. You can see how they're individually labeled. And of course, it being, you know, pandemic, we're meeting outside and doing all sorts of stuff to make this work. So her 20% was approved, and it's absolutely gorgeous. And you can see how she collaged photos, and then she does this very intricate line work that she did on top of, so she painted on top of photos that were collaged, and then it was all enlarged and then printed in the tiles. Next step, please. Next slide, please. This is another detail, and here you can see just the intense line work that she did. Her artwork was very, very labor intensive. Next slide, please. So, and so her artwork is almost through with fabrication. I think it's at 50% at this point. This, of course, is Star Montana's artwork. So this is the tile fabricator laid out the grid, so you can kind of see how the tiles will be. Next slide, please. And this is Star and her assistant Anna with the, again, the tiles laid out, and this is actually in the department. We're going through, you know, figuring out ways to lay it out and do tile checks, and her work, it's turning out absolutely beautifully, or it has turned out absolutely beautifully. And since this photo, actually, her artwork is completely fabricated. So now her artwork is staged and waiting in boxes for installation, which will happen in the summer. Actually, so the LACUSC artworks will be installed in the summer, and the childcare artwork will also be installed in the summer. Thank you.
All right. Thank you so much, Iris, and everyone, all of our fabulous presenters. We have hit the end of our very long agenda, our very long and ambitious agenda. As you know, we covered a lot of ground today. We will be posting a recording of this meeting, the meeting materials, and the chat log on our HICP LA website. So you can catch up there. We'll also be emailing around the information that was shared today, as well as any handouts and other materials we collect from some of our presenters to make sure you get the best information from these meetings. Before we leave, I know there's an announcement from Guadalupe and Pamela about an upcoming tenant rights presentation, and they've shared information in the chat as well. Guadalupe, Pam?
Hi, good morning, everyone. This was another great meeting we had with a lot of packed information. We just wanted to make sure you knew that, you know, the supervisor, in partnership with Eastside Leads, Legal Aid, Self-Help Graphics, and many other community partners, We're doing a State House LA workshop next Tuesday. It's all in Spanish with English translation, and it's for tenants, making sure that they know their rights. They know about the resources through the eviction defense program that we have, and also an update on the SB 91, the eviction moratorium extension through the state, and rental assistance program. So we want to make sure we get the word out. I know that it's in the link, the flyer, and just if you could help pass it along widely to all your constituencies, really appreciate that. Pam, do you want to say anything else? I think we're covered. But I just wanted to make sure folks knew about this workshop on Tuesday at 6 o'clock.
Perfect. Thank you guys so much. Well, with that, it's happy Friday, everyone. Welcome to the month of February. Hard to believe we have made it this far, but there is still a long journey ahead of us. I want to echo and end with a comment from our colleague Tiffany that there is a light at the end of the tunnel, and it's exciting to see so much progress in these very important areas, but the journey is still kind of dark in the months ahead, and it is a long journey to come. So thank you very much for joining us today. We look forward to meeting again in 4 weeks' time on March 5th. And please, if you have recommendations or ideas for presentations and other sessions you would like to have featured at this meeting, please go ahead, put something in the chat right now, send an email to me or anyone on the co-design committee. We'll be meeting next Thursday to design March's agenda. So with that, thank you all so much and have a wonderful weekend.